Welcome, everyone. My name is Adam Savitt. I'm Director of Communications at the Center for Security Policy. I'm proud to welcome you to our fifth and final webinar in support of our Biothreat series for the launch of our new book, Defending Against Biothreats, What We Can Learn from the Coronavirus Pandemic to Enhance U.S. Defenses Against Pandemics and Biological Weapons. After today's webinar, we will be taking a break for the rest of August, but you can catch the archived videos of all 5 biothreat webinars on our website, securefreedom.org. Today's panel is entitled Defensive Failures in the 2020 Pandemic and How to Improve Biosecurity, featuring Paula DeSutter, Stephen Elliott, and John Lauder, and moderated by Fred Fleitz. Please note that you are in listen-only mode, but you can submit your text questions in the Q&A box on the GoToWebinar panel. This event is being recorded and will be available on our YouTube channel, youtube.com/securefreedom, as well as our website, securefreedom.org. With that, I'll hand it over to our Center President and CEO, Fred Fleitz.
Thank you, Adam, and I'd like to thank you all for joining us today for this final biosecurity webinar. We did 5 of these over the last few weeks to focus on the content of our new book, Defending Against Biothreats, which is available right now on Amazon.com as paperback and as a Kindle version. The purpose of this book was not just to focus on some of the immediate issues concerning the pandemic, although we did talk about them. And there's substantial coverage in the book about China's criminal negligence in the way it mishandled the virus. But we wanted to look at some issues that people weren't thinking about, such as what's being done to prevent the next epidemic, what's being done to address biosecurity weaknesses that have not been addressed to this point, and what can we tell the American voter about this issue that they should consider when they cast their vote in November. Our view is that the American voters should be voting for people who want to take real action to address these issues and not simply use the virus as a political weapon to bash the other side. And I hope that the panels we've done and this book will help U.S. voters make that decision. We had 11 fabulous contributors to this book, and I think we saved the best for last. They are all former U.S. government officers and employees, and in terms of full disclosure, there are also 3 individuals who I had the privilege of working with when I was in the U.S. government. Paula DeSutter is an independent consultant. She previously was Assistant Secretary of State for Verification and Compliance during the Bush administration. And in that job, she provided crucial intelligence and policy support to policymakers on states that were cheating on key arms control agreements, such as the Biological Weapons Convention and the Nuclear Non-Proliferation Treaty. She also played a key role in helping remove weapons of mass destruction from Libya during the Bush administration. She also previously worked for the Senate Select Committee on Intelligence and the Arms Control and Disarmament Agency. Now, Paula's having trouble with her camera, and I think you're on right now. Paula, just want to welcome you. Well, Paula will join us in a moment, but she will be joining us as one of our panelists. We also have Stephen Elliott, who is a lawyer and a businessman. He currently is general counsel for IAI North America. He worked for 17 years with the State Department and the Department of Defense, and he did important work for the State Department as Principal Deputy Assistant Secretary for Verification and Compliance. And in that job, he worked on the Biological Weapons Convention, and he was a delegate to the International Atomic Energy Agency Board of Governors. And he was basically sent there to help promote the Bush administration's efforts to stop Iran from developing a nuclear weapon. Stephen, welcome.
Thanks, Fred. Glad to be here.
And finally, but not least, is John Lauder. John is now an independent consultant. He previously worked for 33 years in the U.S. government for the CIA, the National Reconnaissance Office, and as an arms control negotiator. He subsequently served as a senior manager and corporate officer with Arete Associates. John continues to be instrumental in shaping research and strategic planning in the public and private sectors, including as a member of government, academic, and laboratory advisory panels. Now, John has received multiple awards for his leadership in innovation and collection systems, analytic approaches, and vital national security initiatives and decisions. But I just want to say that I know from my time at CIA that John was regarded very well regarded for his leadership and management abilities, and I regard him as one of the best managers I worked for in my time at the CIA. John, welcome.
Thank you very much, Fred. Nice to be here.
Well, I'd like to start off with Stephen Elliott, and I want to talk to you about your chapter, which focused on the Trump administration National Biodefense Strategy. And I just wanted you to talk a little bit about that and maybe update us on developments concerning this strategy since you wrote your chapter.
Sure, Fred, and I appreciate you and the center for inviting me to contribute to the book and to be here as a panelist. Particularly happy to be here with two people I greatly respect, John Lauder and my close friend and mentor, Paula DeSutter. You know, when Fred asked me to contribute to this book, I thought, oh, this is great. I'm going to write about biosecurity in the time of COVID. This is, you know, one of those great historical moments, and glad to be a part of it. I mean, there are so many aspects: China's culpability, the massive healthcare crisis, the biological weapons threat that Paula's going to talk about, and then Fred asked me to contribute a chapter on the National Biodefense Strategy. You know, I thought it was kind of like, okay, we're going to write a book on the Titanic, and somebody's going to write a section on an iceberg, and somebody's going to talk about the problems with the ship, and some people are going to talk about the rescue operations. It's kind of like I get to talk about the user manual for the Titanic. But in doing so, it's very instructive because you get to get a real feel for what the advantages were going in, how reality, and that was the title of the chapter, how reality intrudes upon plans. So that was kind of one of the strategies. I think one of my approaches has long been a question of efficiency. Like many of my panelists, as Fred said, both panelists and Fred himself, and many of the authors here, we spent a long time in the government. We spent a long time as bureaucrats. And when you read this national biosecurity policy, it is clearly written by bureaucrats. It's written by a committee. So there's a determination to cover every issue. There's a determination to have everything covered. There is thinking about all of the various interests in the U.S. government, which agencies are covered, who is important in the process. What there is very little about is any kind of idea about implementation. And so it kind of reminds me of a story back when I was in law school. A professor of mine who went with a committee on the American Bar Association to help Kazakhstan write its new constitution. This was the early 90s. And he came back and he said it was a thing of beauty. We had lawyers from Great Britain and lawyers from Germany and took the best of all our constitutions, and the Kazakh constitution is a thing of beauty. But then what he said was it was a complete waste of time because there was no sense of the rule of law. And when you read this national biosecurity policy, and I'll get into some of the details of it, and then as Fred asked, I'll talk about where we go from here. It reads very well. It covers a lot of the key issues. It makes a few very different approaches to biosecurity, and so in that sense, it's a good document. The problem really was that one, it had only been in place about a year and a half before COVID took place. A little less than that. And once reality, that is COVID-19, happened, it really became a moot document. Nobody refers to it. The processes that are in the document simply didn't happen. And I'll get into that a little bit more. there are some good aspects to this document. A few things. For example, it starts to define policies and issues that simply hadn't been done before. It tries to attach a process to what happens if you have an outbreak. The problem was that when an outbreak actually happened, the process wasn't followed. And I think if you go back, some of this it has to do with what problem they were trying to solve. And it really goes back to the Ebola epidemic of 2014-15. Now, it was clearly a worldwide epidemic. More than 10,000 people died. In the United States, that was only one person. It was seen as something of a success in trying to put in place some of the effective things that were done during the Ebola epidemic from a U.S. perspective, not necessarily from a West African perspective where it was out of control for a bit. When you actually read the document, it does read there as if Ebola was the problem. They're looking at rapid response, how you identify cases right away. And so when COVID actually hit and you had an environment where you had people with the disease who were not symptomatic or they weren't symptomatic for a lengthy period of time, when you get Ebola, you know it. And the lethality is so great, it's something like 70%. That
Hey,
when
Steve, I want to move to John Lauder now. And John, you wrote about the Defense Science Board, and it's interesting because the recommendations you wrote about from your experience in the Defense Science Board were similar to the Trump administration's National Biodefense Strategy. Could you talk a little bit about the Defense Science Board and maybe where we are right now and what we've learned, what we should have learned, and what we should have implemented from its recommendations?
Well, thank you again, Fred, to you and your center for hosting this event and inviting us to participate, and for your very generous comments when you introduced me. You know, it's interesting in the several weeks now since we wrote our chapters. I am more and more struck by how much the development of the pandemic, the economic and societal consequences, the efforts of the government to deal with it, how much of all that really rhymes with the history of the findings and recommendations and fears that were part of a very fertile conceptual era from about the mid-1990s to about 2005 in trying to do what Steve said earlier, I guess, to write the owner's manual of how to deal with a pandemic, either a naturally occurring one or a bioweapons threat. And much of the way the U.S. government views, as Steve was outlining some of what was in the current administration's biodefense plan, much of the framework for that was forged in those 1990s. And as I've gone back and I looked at those documents again, including a very seminal conference that was held at Stanford in 1998, a very thick summary of those conference results, how contemporary those findings seem. There were several sessions at the Stanford conference, for example, that talked about the need to strengthen the public health infrastructure, to increase stocks of antivirals and antibiotics and vaccines, and even an extensive discussion, and I know Steve has some of this in his chapter too, about should there be a national stockpile of ventilators. And through all this, there really was a consensus reached that extended across both political parties, that extended from federal and executive and legislative branches of government to state and local and tribal governments and to the general public about what needs to be done. But as Steve indicates, just having plans is not enough. And that's why the Defense Science Board summer study that you asked me about, Fred, is I think so instructive in a way and sobering. That was at the end of this era, and it followed not only this extensive work that was done on biological weapons and how to defend against them in the late 1990s, but also followed after the 9/11 attacks and the anthrax scare in the U.S. capitals. And members of that Defense Science Board summer study were some of the same folks that had helped put together those conceptual framework, that conceptual framework in the 1990s. But the really sobering thought about that Defense Science Board report was that it was finalized in the summer of 2005. And those of us who were on that study team had received extensive briefings about here is how the government would respond to a great disaster, particularly a man-made attack, but also naturally occurring disasters. What at the end of that summer was Katrina. And as we were skeptical in the summer study that all the plans had been sufficiently exercised and that everything would move smoothly in the handoff between the federal government and state and local governments, and that military resources would be there, we learned tragically later that summer as Katrina moved up the Gulf how one continues to have to work very hard, very diligently and constantly to prepare for the sorts of activities that we're facing now as we try to deal with the coronavirus pandemic, which is in some ways our own worldwide Katrina. I can get into some of the recommendations a bit greater detail, Fred, but I'll let you guide me with your questions.
Well, I want to move to Steve for a moment. I regret that for technical reasons, Paula DeSutter won't be joining us, but since Steve also worked in the verification world, I'm going to.
It was also Paula's deputy, so maybe I can contribute a little bit of that.
I know,
I'm on the phone.
Oh, Paul, you're here. I'm sorry. I was just told you weren't joining us. Well, you're just in time. We've already given you a great introduction, but you'll have to watch in the video later. But now John Lauder and Steve Elliott have talked about the Defense Science Board and the Trump administration's National Biodefense Strategy. I want to ask you to talk about international biodefense efforts and basically what we need to think about concerning international biodefense right now. What are their weaknesses and how should we address this in light of the coronavirus pandemic?
All right. Well, first, Fred, I wanted to say that I think what you guys have produced is a fantastic book. I think I kept thinking, gee, my chapter is the boring one. But in any case, I mean, it really is remarkable. And I've watched 2 of the 3 videos, and they're just really excellent. So that said, whenever there's a massive problem, many in the U.S. say, well, I think what we need is an arms control agreement about it. And so a part of what I wanted to talk about is that there are currently, by the way, I just tried a different computer to see if I could connect. Oh, wait, maybe. But one is the Geneva Protocol from 1925 that bans the use of chemical and biological agents. I might be there. And the other is the 1972 Biological and Toxin Weapons Convention. Now, well, a lot of people, oh, there's me. Well, I see Fred. So it does not have an on-site inspection. I'm sorry, Fred, I think I'm about to be online. I'm unmuted. I'm sorry. Why don't you talk to Steve and let me get this going? Because I think I'm about to join him. Oh boy. Fred, go ahead and talk to people. I really apologize, but I think
Okay, Paul, we're going to have to move on in a moment. So if you can wrap up, and I need to ask Steve something.
the problem is that all of the bodies, including the World Health Organization, that do investigations, quote unquote, are only able to operate if they are invited by the host country. So if you've got a case like China, where they've mucked about with everybody, the odds of being invited in to do a rigorous examination is limited. It's very similar to any of the problems with the Biological Weapons Convention. I was very impressed when you asked Claudia Rosette what she thought should happen since the United States has withdrawn from the World Health Organization. And she said, we need a new investigative body. And I think that that's very true. And that if people are really serious about things, I'm not suggesting that China used COVID as a biological weapon, but I think it does offer us a vehicle to say, all right, let's pretend that it was biological weapons use. And let's do an investigation as if that were the case, to exercise the capabilities to see what can and can't be done. China obviously is going to be as reluctant to permit that as they have any other bit of information gathering that anybody can do. But, you know, the World Health Organization is clearly not the answer. Neither is Doctors Without Borders or Interpol. They're all flaws in what they do. And use has always been the part of the Biological and Toxin Weapons Convention that we've long held would be the most obvious evidence of a biological weapons program. So I do think that there is a new vehicle required, but it would have to have the kind of teeth that those with biological weapons, including China, who we believe does have an offensive biological weapons program, that they might not want to permit. And so it's a matter of how much do you care and what are you willing to pay for it.
Okay, I have some follow-up questions I'm going to ask you in a moment, but I want to move to Steve Elliott. And actually, this is a question I'd like both Steve and John to address. You both deal with the issue of leadership in dealing with epidemics, how U.S. presidential leadership, NSC leadership needs to be improved, and that I think it's fairly believed by people around the country right now that there are some leadership issues that we need to address right now, not just at the federal level, but the state and local levels. Talk about that in terms of your chapter, Steve, and what we've learned over the last couple of months in dealing with epidemics.
Sure. I mean, the policy does, the National Biodefense Strategy does a pretty decent job of laying out who should do what. It has responsibilities for a committee headed up by the Secretary of Health and Human Services. It has a role for the National Security Advisor, obviously, particularly if there were a biological attack or just national security issues. The problem is that when COVID hit, we didn't see either of those people, Alex Azar or Robert O'Brien, and they just were really not players in this. The president formed an ad hoc committee, put the vice president in charge. He obviously got involved himself very heavily. The vice president was obviously very involved. I think from a public policy point of view, there was a heavy leaning on doctors. And it was, unfortunately, sometimes who was most photogenic. For a while, it was Dr. Fauci. For a while, it was the vice president. For a while, it was the president himself. It just kind of varied from time to time. I don't know whether those were the people making the public policy decisions, but it seemed very ad hoc. Separated from the National Biodefense Strategy. It seemed change from week to week as to who was in charge. I don't know whether that was the way the decision-making process was. I do think that having scientists make public policy decisions is, we've kind of run into this world of experts. And you've got generals making decisions on behalf of DOD. You've got scientists making decisions on behalf of Health and Human Services. It seems like a logically good idea, but that's not how we make public policy in this country. There ought to be a very organized, functional process by this. The strategy attempts to do it, but it was thrown out the window in the crisis of COVID-19.
So, John, you touched on the same thing in your chapter, and you also urged the need for strong presidential leadership. Could you give us your take on this?
Yes, and I very much, when I listened to what Steve had to say in his assessment, how much of that is echoed in these recommendations from the period that I covered. I mean, to quote from the Defense Science Board report, for example, that you asked me about, that was assessing how well the government might be prepared to deal with a major public health emergency. It says the lack of preparation appears to result from several key factors: fuzzy lines of responsibility and authority among local, state, and federal agencies, a lack of a sense of urgency, and the tendency to emphasize physical effects of an attack or a public health outbreak with little regard for the psychological. Then the study went on, and I think very much directly relevant to your point about presidential leadership, and said that the president and other senior officials should communicate, quote, clearly and honestly, with realistic assessments and guidance to gain and maintain public support and to increase the sense of urgency. In all of the studies from that time frame that I discussed had several points in common. One, they note that presidential leadership is key, that government bureaucracies and budget overseers and the public as a whole pay attention to what the president believes is important. Secondly, that effective action requires bipartisan executive and legislative support and a whole of government approach. We're asking the public and the Congress to do difficult things, and fostering a consensus helps ease the political pain and marshal the resources. The nature of biological threats also requires strong public-private partnerships. Steve mentioned the important role of scientists. One of the striking features of the work that was done in the late 90s was the extent to which the leading scientists of the day from outside the government were energetically and publicly engaged. And then, as Paula and Steve have both mentioned, we saw international data sharing and information disclosures as vital. And finally, the other theme that came up in many of those studies was that transparency and credibility with the public help build support and are essential for crisis management. The public needs to believe that the political leadership is telling it like it is.
That's great. Thank you, John. Paul, I'm going to go to you in a moment, but I want to also remind our audience that we will be stopping for questions, and you have the ability to text questions to us through the GoToWebinar site, and you can start doing that now if you want to, and my colleague Adam Savitt will be collecting them. So if you have questions for us, you can start on that right now. Paul, you raised an important question about an international inspection regime that would help verify the Biological Weapons Convention and basically address the issue of natural and man-made epidemics. But the Biological Weapons Convention itself does not have an inspection regime. In fact, there are many U.S. officials who have opposed that over the years. And I'm wondering if you could talk about the impediments to starting an inspection regime for that, because there are proprietary things that various industries do that they may not want international inspectors to see. But I'm just wondering, has this has this thinking changed now, and how does that problem fit into the situation we're in right now?
Well, I've been among those who have opposed trying inspection under the BWC. And there are several reasons for that. One is that the way that the BWC is constructed, you have to be able to say that there are production of biological agents in types and quantity not justifiable for peaceful or prophylactic purposes. And that's a very difficult type of decision to have to make. It doesn't take a lot of biological weapon agent to be very destructive. And in the case of infectious diseases, one person can be the vector that spreads the disease. So it didn't seem to me to be very useful because you would have to negotiate it. There would be limitations on access. And so I thought that was a pipe dream because for me, as a verified, it is worse to have false confidence in a verification regime than not to have an inspection regime. Now, the interesting thing about China and the BWC is that they created a set of confidence building measures that required parties to declare their original offensive program and how it was destroyed, because that's an obligation in the BWC to eliminate any offensive program, any agents, any equipment. And China submits its confidence building measures every year. The problem is...
Well, let me interrupt you for a minute. You know, many U.S. officials do not want an inspection regime for the BWC. Why is that? And has their view changed? Well,
not that I know of.
What is the argument? Why won't they agree to this?
Because the inspections if you created a regime under that document, it would be so constrained that you would never get evidence of anything other than compliance, because they're not going to show you anything. What you want to be able to do is to get to the people who are being affected by it, the scientists that may have been involved in production. And there is no way that countries are going to permit that. And so part of the problem with the BWC is that you have to construct a very circumstantial evidence case. And even if there's use, people will doubt you. We saw that with yellow rain, which I still believe the Soviet Union assisted their friends in using it. So I don't believe that an inspection regime under the BWC can provide you the kind of evidence that you need to do the whole thing.
Okay.
Now,
Paul, I'm gonna move on to Steve Elliott now, because we're gonna run out of time. Steve, I want to turn to the recommendations you made at the end of your chapter to address the shortcomings of the National Biodefense Strategy put forward by the Trump administration. Could you talk about some of the most important recommendations you made on how this document could be improved in response to the coronavirus pandemic?
Sure. I think that it's really twofold. We've got to take into consideration what happened, what we learned, what we did right, what we did wrong. That's kind of obvious, I suppose. And so we've got to do that. We've got to take an honest measure. Take, for example, ventilators. We rushed into a decision on ventilators that we were going to need, I don't know, 50,000 in New York and 80,000 elsewhere. And so by the end of the year, we'll have 200,000 ventilators. We will probably not need more than about 16,000, as it turns out. Even if we wanted to stockpile some, perhaps we'd need 20 or maybe even 30,000. We spent $3 billion to get these ventilators, money that could have been used elsewhere within this. So that's just one example of where we simply made decisions not carefully and thoughtfully, but just based upon, press conferences by the governor of New York. And so we've got to put in a policy that relates to, and I think we've just got to scrap the existing strategy. There's really nothing in there that we followed during COVID, or frankly, probably should have followed during COVID. And so I think we need to start over. We need to take our lessons learned, what we did right, what we did wrong. What we really need to do is to understand how decisions are made. Not just what's the science behind it, or what the what the processes should be within the federal government, which agencies should be involved, et cetera. But how do you make public policy decisions on the public health issues? How do you make public policy decisions on the international verification regimes that Paula was just talking about? How do you make public policy decisions with regard to economic recovery? And so I think we need to attach our lessons learned from that into a new policy. That's the only way. I think the policy was probably doomed to bureaucratic oblivion until COVID-19. I think we've just got to start again.
Fred, if I could just add.
No, I want to go to John with something, Paul, and then I'll get back to you for a final question before we do questions and answers. John, I want to ask you a similar question concerning the recommendations that you made at the end of your chapter and lessons and recommendations from your work during the 90s and 2000s that have been illuminated by the coronavirus crisis.
Well, Fred, I think I summarized a few of those recommendations earlier, but let me just say that one of the things that strikes me as I look at those recommendations, for the need for presidential leadership, the need for transparency and credibility, the need for a bipartisan consensus, is what really those studies in some ways didn't anticipate in the current pandemic and the response to it. And there were three things that strike me as being on the negative side and two things on the positive side. One is the difficulty in forging a bipartisan, non-political approach to the pandemic. I think Steve has touched on that a bit in some of his comments about how decisions are made. Back in the late 90s, when we were doing some of these studies, we had people like Sid Drell on one side, Speaker Gingrich on the other side, working together about how we would plus up the capacity of the U.S. government to deal with biological weapons threats and public health crises. We also thought that we would be part of a broad international coalition, and putting together an international coalition to deal with the current pandemic has not proved to be either a high priority or easy to do. And third, we spent a good bit of time thinking about what is that relationship between scientists and medical professionals and policymakers, many of whom are not schooled as scientists. They're often lawyers. How do we translate things? And I know Steve mentioned this in his chapter as well. How do we translate things like modeling and simulation when we're trying to say, here's what the range of disease outbreak might be if we didn't take certain actions? We didn't recognize that, in fact, there could be significant parts of the public that would be distrusting science. It wasn't just a matter of translation, but how one builds trust. But I said there are two aspects that that I think we would have been surprised by how well they worked. One is just the response of organizations acting semi-independently like the Federal Reserve. When you think about what the Federal Reserve has done to mitigate the economic consequences of the current pandemic was really something at a scale that we didn't conceive at the time, because we were very much worried about the societal and economic impact of a major biological attack or the type of public health crisis that we're facing now. In fact, we actually had some extended discussions about what it would mean if shopping centers closed. Could the U.S. economy survive shopping centers closing? And in fact, we've discovered that in some ways we are to some extent. And that's because of the other positive development is technology has done a lot for us. We've discovered that we can produce vaccines at a faster rate. We can produce medical countermeasures at a faster rate than we first conceived. And although the impact on some sectors of the economy, like travel and leisure and hospitality, on small businesses, on small restaurants, on small shop owners, has been horrific, much of the economy has been able to endure this pandemic because of things like what we're doing now, that we can get together on a GoToWebinar or a Zoom call and transact a business that otherwise might require us to be in personal proximity and in more danger of the pandemic.
Thank you, John. Paul, I want to give you a chance to wrap up with your recommendations for the future, and then we're going to go to questions.
Okay, thank you. My conclusion is really that while I don't believe that it would be useful to have an inspection regime to address the entire biological and toxin weapons convention, it might be a great idea to create an inspection capability to investigate both use under the 1925 Geneva Protocol and the BWC. It would be important to limit it to that, but I think that might be a good solution.
Okay, well, thank you. Well, now I want to welcome my colleague Adam Savitt, who is helping run this whole show. And Adam, do we have any questions?
Years after Katrina, we can see city, state, regional failures. What accountability should we expect post-COVID?
I think one of the views of those of us that have labored in these vineyards of trying to come up with the game plan for how one would deal with a crisis is that it really does require a whole of government approach, or as has been stated in some documents, a whole of nation approach. Really does require close interaction among federal agencies, between the federal government and state and local, and not just having view graphs that say, when the crisis comes, we're going to cooperate, but rather plans that have been exercised, resources that are marshaled. That was one of the lessons of Katrina. We knew what would need to be done to help restore a city like New Orleans that had been ravaged by the hurricane. But we hadn't worked through the details of whose responsibility it was going to be. It was going to be a federal responsibility, a state responsibility, a city responsibility to evacuate people, to move needed supplies to the right locations. And what we have seen is in the coronavirus outbreak is those same sort of breakdowns. We talk about ventilators. Well, how are decisions made to decide how many ventilators are needed? Where should they be stockpiled? Who makes those sorts of decisions? And the question dealt with responsibility. In some ways, we're seeing some of our political leadership move away from taking responsibility. So it's not my fault, it's somebody else's fault. that 160,000 Americans will soon be dead from this pandemic, and I think that's the real measure of accountability, to see leaders standing up and saying, "I'm trying to do my part. I'll take responsibility for this this aspect of trying to help us work through the implications of this very deadly and economically damaging pandemic."
I think one aspect of all this, whether it was Katrina or some of the other natural disasters, is they tended to be localized. Hurricane here, tornado there, terrible snowstorm, whatever it is, El Nino. And so there was an easily identifiable person, the governor, FEMA, whoever, wherever that was. This is a national event. We really haven't had this probably since 1918. And so given our federal system, very often is unclear. Is it a mayor? Is it a governor? Is it the president? Is it the secretary? Is it FEMA? Is it Health and Human Services? Is it CDC? And that's probably something we need to build into our system, into whatever policies we come forward with.
Do you have any confidence there will ever again be bipartisan approaches to a pandemic? I think referencing that every aspect from masks,
or any.
Yeah.
There you go.
I'll take the first cut at that. I'm an incurable optimist. The only real answer I think one could say is, of course, we will. I think one of the things we'll learn from this pandemic, and learn from a whole series of political and strategic questions that we faced over the last few years across several administrations, is that we have to look for these solutions that cut across party lines and cut across institutional lines, and that's an aspect of leadership, is looking for those folks on the Hill, for example, and there are some in both parties that can stand up and help forge the right consensus and the right willingness to act. I think that's what Fred was speaking to when he introduced this panel, that elections matter, and maybe we want to look for people that can work across lines.
I would just add that even in the COVID, there has been cooperation. Being in the private sector, I actually have read all 883 pages of the CARES Act and its follow-on legislation, and that passed almost unanimously. That was people in a room. It was a bit of a mess because it was 883 pages and it was passed in 3 days. But that's people getting in a room and they all had the same agreement. Yeah, there were some disagreements on some details, but by and large, there was a recognition that the economy needed this. And people needed the unemployment, et cetera. So even in that, and even in this environment, there have been occasions where that has happened.
I want to add, I really do think we will have bipartisanship on threats like this. It's difficult given the current political environment and an election year. The center will be holding some voter education webinars this fall, during which we'll be talking about various national security issues that voters have to weigh. And this is among the issues voters have to weigh to make it clear that they're going to hold politicians accountable who are not taking serious positions on issues like this, and instead using them as political weapons.
Again, for anyone, do you think the Trump administration has a full grasp on the scope of the threats you're talking about?
I think they do, and I think that it's worth noting. There's been a lot of criticism of the way the president and his administration have handled the virus, but I think if we put it in context, the U.S. did much better than most nations. We didn't do the best, but we were better than most. This was an unprecedented challenge. The U.S. government clearly was not prepared for it. This is a problem that goes back many years. And we know that our government has this problem of always fighting the last war. We're prepared to fight battles that we've won or lost in the past. this one, no one was prepared for. And I mean, mistakes were made, but some very important decisions were made also that I think saved a lot of lives. The president's decision to cut off travel from China in late February was a very important decision. It was very controversial at the time. We now know he was absolutely right.
In the 90s, fears about rogue scientists or missing materials from the Soviet Union were spoken about frequently. Did that threat never materialize, or might it still be hiding somewhere?
I think it's probable that it's there. Go ahead, John.
No, I agree. I think, one of the reasons that some of the recommendations of the 90s never found their way to total fruition was the fact that the government is often driven by the tyranny of the inbox. We worried about rogue scientists with WMD information and the security of nuclear and biological and chemical materials. And so we instituted a lot of programs, the non-nuclear programs, a number of arms control initiatives, a whole variety of efforts, some of which Paula was very much involved in, the dismantling of the Libyan WMD capacity. And I think that it was the success of those programs is why we didn't have the type of attacks we feared. But as Paula said, I don't think that threat has gone away, and it requires continued attention and vigilance to make sure that the worst weapons in the world don't end up in the hands of the worst people of the world.
So next, just someone more with a comment. I think this is a common sentiment, but he's enjoying the presentation, but what can he or what can we actually do to guide public policy and implementation on these issues?
People underestimate their ability to reach out to their congressmen, to their senators, and make their views known. And they can organize themselves in such a way that those communications are more powerful. And so it's one of the things that is really true is that members of Congress are receptive to the views of their constituents.
It seems unclear what exactly caused the explosion in Beirut, but is there similar potential for a chemical weapon or a biological weapon to meet the same fate?
I think there's a very significant chance of such a thing happening. And Sam Faddis mentioned in a previous webinar how, we all know there's been complaints about biosafety rules not being followed in China. There's problems with biosafety rules not being followed in the United States, including at the CDC in Atlanta and at Fort Detrick in Maryland. There have been instances of smallpox vials being found by accident at a government laboratory in Bethesda just a few years ago. So my concern is that if the security rules aren't being followed here, what's happening in other countries, less developed countries that have high security biolabs, and what is the security like that's going to prevent terrorists and possibly rogue states from stealing pathogens that could be used to stage biological weapons? So I'm not saying that's going to happen, but I believe we have to do a lot to improve biosecurity.
I would just add that the striking difference between the explosion in Beirut and the types of dangers that we've been talking about in the book and this panel is, in the Beirut case, you could see the explosion. If something leaks out of a lab that's not well secured, along the lines that Fred noted, it might be weeks before you realize how imperiled that we could be.
That's all we have at the moment, Fred. But
Okay, well, I think we're ready to wrap up. This is great. I hate to end this. This has been so much fun. So this is the final of 5 biosecurity webinars the center did in conjunction with our new book, Defending Against Biothreats. I hope you'll check it out. I'd like to thank Paula DeSutter, Stephen Elliott, and John Lauder for joining me today. We recorded this webinar and it will be posted on our website, securefreedom.org, under the webinar tab. You'll find videos of the other 4 webinars there, and I hope you'll check them out. We also have a lot of analysis about the threat from coronavirus, China's criminal negligence that caused it to spread, and many other issues concerning this issue that I think policymakers and the American people need to know. So I'd like to thank you so much for joining us. This will be our last center webinar for the summer, but we'll probably be resuming them about the second week of September, and the theme will be educating the American voter on crucial national security threats. So to our panelists, I'd like to thank you all for joining us, and for our viewers, thank you again, and I hope you'll join us soon.